Welcome, everybody. We are excited today to have Dr. Tyra Tostin-Gross. She is an associate professor of public health at Xavier University of Louisiana, where she has worked as a public health instructor, researcher, and mentor since August of 2015. Given her interest in maternal and child health, the majority of Dr. Gross's research has focused on the health of reproductive age women. Her current research projects explore the health of Black postpartum women in Louisiana, infant and young child feeding during emergencies, and smoking cessation needs for low-income pregnant women. Thank you so much for being with us today, and I'll turn it on over to you.
Hello, everyone. Here on Central Time, or different people on different time zones. So good. I'll just say good afternoon. I'm in New Orleans. Chicago was gorgeous this past weekend. So wherever you are, I hope that you're having wonderful weather. I did ask that the chat be open, the chat feature be available to us to use during our session. I'm a university professor, so I'm used to using the chat feature for online teaching. So if you would do me the glorious favor of putting in the chat, if you desire, your name, your current role in the organization that you're with, and a fun, non-related word fact. So I had Chicago deep pizza from 2 different places over the weekend. I definitely am biased. So that's a non-work related fun fact about myself. So let's see, in the chat, give yourself a nice shout out, hobby, interest, last place you vacate, favorite thing on Netflix, Hulu, Prime, whatever it is you're into. Just would like to get a feel for who's in the audience. I'm very big on engagement, so I'd really like to get to know whoever I could. And make sure you click everyone if you'd like for others to know that you're also in the room. Thank you, Catherine. We have 47 people in our session. Shout out to Hannah from Madison, Wisconsin, nurses, 7-month-old, awesome. I am 17 weeks pregnant with my 4th baby, so much love to you, Hannah. Kimberly, nurse educator. Amanda Hancock, UTMB. I did my postdoc at UTMB. So shout out to you. Somebody just came back from the Virgin Islands. I loved St. Croix last year. One of the best places the pandemic let me actually get to. Rosemary, Jamie, Lori, proud Mimi. Thank God for Mimi's. All righty. So keep those coming in. For the sake of time, I will progress forward with my slides. So today I'm talking to you about a review of pregnancy risk assessment monitoring system, which is the PRAMS abbreviation. Data on Black maternal health before the COVID-19 pandemic. So thank you for being with me. Today, I am a bit of a storyteller. So here's a quick little story. There is something called the 7 generations principle that I've learned from several Indigenous sisters that talks about before you make a decision, you really think about the next 7 generations and the impact, whether that's environmentally, financially, culturally, and health. And I just think as a person, that legacy is such a big value to me. I really loved learning about this principle. So before you make any decision, consider its effect on the next 7 generations. So really having that forward mindset before you act. So something I also learned from these Native sisters is that we can't think 7 generations out, but we're also smack dab in the middle of 7 generations, right? There are 3 generations before us, our generation, and then the 3 generations after us. So some of you mentioned being mothers, mimis, maybe you're a wonderful auntie, or we say nene as for godmothers here in Louisiana. So we think about what have we inherited from the past 3 generations, right? I know epigenetics is a really big thing that is kind of like the context of how our ancestors grew up and developed in that fetal programming that happens. If I'm getting too sciencey, forgive me. But then also, right, looking forward, what will be inherited from us. So I think these legacy questions are really important to think about in this work that we do in maternal and child health. And I'm doing this presentation in honor, if we go back 3 generations, this is one of my maternal great-grandmothers. Her name was Eloise Piku, Creole lady. She actually died from childbirth complications, giving birth to a set of twins. My grandmother was the only surviving twin. So in my family tree here in New Orleans, not far from where I gave birth to my own children, I have the legacy of maternal mortality and infant mortality in my family tree. And I think some kind of way that history is what has fueled me and guided me into this work. So I just want to honor her and my grandmothers before me. So learning objectives. Discuss what is the PRAMS survey, this postpartum survey that the CDC and different tribes, cities, and states administer to postpartum women. Explain research opportunities, especially for PRAMS, to center Black maternal health. So this presentation does center the experiences of Black women and their birthing outcomes. But thinking about before and during the COVID-19 pandemic, right? March 2020, everything hit the fan. And we started talking about how things changed during the pandemic, but where were we even before that? The mall map, you are here, right? But how did you even get to here? And I want to describe a current research project that I have using Louisiana PRAMS to assess Black maternal health. So why Black maternal health? I don't want to just assume that everyone here is familiar with the disparities, but we know that here in the United States, unfortunately, as compared to our other developed nations, we have some of the highest rates and increasing rates of maternal mortality, as well as maternal morbidity. So it's not just that we're losing mothers, but a lot of mothers are also getting sicker or already having chronic conditions as they enter motherhood. CDC and other national reports indicate that Southern states have the poorest maternal health outcomes. I was really inspired by the panel on Medicaid and opportunities for improvement in Southern maternal health. That was the session before this one. And again, Black women experience a greater burden of some of these poor maternal and therefore infant health outcomes. So some infographics from over the years that you may have seen, just kind of comparing US African-American or Black mothers to mothers in upper middle income countries. So think of Brazil, that even though we're in the land of the free, home of the brave, that our outcomes just within the Black population are looking like other countries. So another infographic that talks about non-Hispanic Black women, the maternal mortality rate. But what I like about this one is it also shows that for our non-Hispanic white sisters, that they're not exactly, having the best outcomes globally either, when we think about France, Japan, and what have you. We know there's hope through a lot of policy initiatives like the Black Maternal Health Momnibus. We know that on my birthday, actually, the Biden-Harris administration released their blueprint for maternal child health with their different, I believe it's 5 different priority areas. So there is hope while we're hanging on and hoping that we can see the right at the end of the tunnel that COVID has created. So why Louisiana? Louisiana and Mississippi kind of play tug of war for who's going to be 50th in public health. But in any given year, if we're not 50th in public health, we might be 49th. We might even get in a 3-way argument with Arkansas and be 48th. But typically we're at the bottom when it comes to public health outcomes overall. And I mean, we've faced a lot. Not that other states don't, but particularly if you think about natural disasters and it's hurricane season and we're still in an infant formula shortage, which is one of my other research priorities right now, is if we can show success in Louisiana, we can help to translate that success in a lot of different areas across the country. So here in Louisiana, 45% of all pregnancy-related deaths were deemed preventable. So our maternal mortality rate has been even higher than that of the rest of the nation, which is discouraging. But when we look at some of these pregnancy-related deaths that were preventable, there were a lot in terms of patient-level factors such as chronic disease and delay in seeking care and access to care. But we know that it's not just that cut and dry, right? Like the larger level statistics. And again, we see a 4-time disparity between Black women and white women in terms of pregnancy-related death. Again, we always want to give a shout out to Unique Success. So there have been some efforts over the past, not even the past decade, but longer than that, to extend Medicaid for a year postpartum. Louisiana Perinatal Quality Health, I'm getting the acronym. But there's been a lot of efforts. But receiving an F from the March of Dimes is not really encouraging. And then also when our Office of Women's Health is trying to be established and having some battles, even creating that office when we have such disparities. There still remains a lot to be done, and COVID has just amplified all of this. So why PRAMS? And let's see, in the chat, how many of you are familiar with PRAMS? If you're familiar, just say yes. Yay, okay, a lot of yeses. Great, well done, class, well done. So for many of you, this is just a refresher. I was born in 1985, so PRAMS has been around for a very long time. So in 87, the overall goal was reduce infant morbidity and mortality by influencing maternal behaviors before, during, and immediately after pregnancy. It covers about 81% of all live births in the US, at least that's how they weigh the statistics and when they do the sampling of recruiting the mothers to take the survey. So 46 states, I think Ohio, California do something similar to PRAMS. They're not PRAMS participating currently. The United States Virgin Islands, I know someone just traveled from there. They used to participate in PRAMS. So there's a lot of power in this survey. So it's a postpartum survey of women with a recent live birth. There are some states, some cities that do survey women that had a stillbirth. Which I think, again, shows the power that this survey can have in helping to develop programs and policies. So, go to that slide. So currently, this shows a map from the CDC of PRAMS participating states and territories. So again, a lot of coverage there, which allows for comparison, state comparisons, regional comparisons. Aggregation of data. Some of the main things that the PRAMS survey covers: preconception health, breastfeeding, happy breastfeeding month to all of you also, tobacco use, contraception use, and the list goes on. And I'm going to try my best to go. So hopefully, nope, that's not the one. That is a survey, but I want to show you the actual website that I had open. There we go. So this is the landing page for Louisiana PRAMS. I'll share that with you in the chat just in case. Thank you, Bria. She says Ohio has OPUS, which mirrors PRAMS. So you can see here on this link, it has our surveillance reports, the current survey questions, opioid supplement questions. So in the year 2019, in addition to the core questions that our survey asked, they also asked women about opioid use. They called some of those participants back to follow up with them. COVID, several states have added supplemental COVID questions for the 2020 year. Louisiana also participated in doing the disability supplement to really see, for I believe the first time, the maternity care and health experiences of women with disabilities. So just because I'm a visual learner, I just want to show you, here's Louisiana's questions. State by state, your questions wording may be a little bit different. But one thing you can see is this is long. This is 16 pages. And for a qualitative researcher like me, that last page where women can free write, or they can, if they're doing the survey by phone, they can share. Are they making it to that back page? But that's a conversation for another day. COVID questions, disability questions, eyesight, hearing, mobility. So I think there are wonderful opportunities to better utilize this survey. So again, birth certificate records, different states and organizations that use PRAMS or administer PRAMS, they get live birth certificates. They randomly find a representation of women that they then mail surveys, and then depending on if they get responses, they will phone them. So we know that phone component, also the mail component, with a lot of people being transient, has its limitations. Okay, so I really encourage you, if you want to know more about PRAMS methodology, a really good article is by someone at the CDC, so Schulman et al. 2018. So what perspectives do I think are useful? So if we're centering the experiences of Black women, right? When we think about health equity, I don't think we always need a comparison group by race. So within Black women, what if we, I think about a video that someone shared in that Medicaid panel is, what if we wanted to look at Black women by SES, educational outcome? We don't always need to have a different race as a comparison group, because I think that can often be triggering, frustrating for some of our Black sisters to always be told that their outcomes are worse than, but our lived experiences are also very different than. So with intersectionality, why explore subgroups of Black women? Is there proven variation in outcomes? If you're familiar with the concept of intersectionality, we have many different identity categories at any given moment in time, right? So if you think about immigration status, right? First generation Blacks that may be coming from the UK, West Africa, their outcomes may be different than those whose families have been here for generations upon generations. Education, I think I mentioned that. Geographic location. Oregon has some of the best Black maternal health outcomes, California also, but a lot of Black women and families are concentrated in the southern states, and history can tell you a lot more about that. Positive deviance. Why use strengths-based perspective? Why consider community or cultural assets? And I think the opening keynote speaker did a great job of saying we have to make sure that, we're telling the right story in a way that invites people into the conversation of the role that they play. So always showing the disparity as the, whoa, here is the problem, but not saying, hey, we're noticing some favorable solutions right here in the community. How do we amplify that? So recognizing that solutions don't always come from outside. Many times they come right from within the community. So that's what the concept of positive deviance is. So what are the findings on Black maternal child health using PRAMS? So really quickly, the last part of this talk, I just want to highlight some findings from a literature review and also a qualitative analysis from some Black postpartum women here in Louisiana. So literature review plus a mixed method study, unfortunately, because I am not that strong in quantitative statistics, COVID pandemic has derailed my research timeline in terms of getting some quantitative analysis done. So happy to keep you in the loop with what goes on with my work in the future. But today I'm just going to focus on the literature review and the qualitative component. So literature review. So if this slide seems pretty wordy, just hang tight with me. So had a really great MRE, so shout out to people who are affiliated or alumni of Emory University, who we did this literature review to really see, since PRAMS has been around for such a long time, if we look at some of the publications, what are some of the findings that we can pull from PRAMS publications, whether that's CDC publications or other researchers that have findings on Black women in there, okay? And then we also said, well, we know that these are the states that are PRAM participants that have large Black populations, and we define large by either 20% of their citizens identified racially as Black, or they had a 1 million residents. So for example, Blacks don't make up 20% of California's population, but they are over 1 million. So we wanted to find state-specific PRAMS websites to see if they had any PRAMS reports that were written for that state-specific stakeholders about what was going on in that state. So some of the literature review findings, and these may not be surprising to you, but still want to present. So here's some of the things that we knew coming into the COVID-19 pandemic. Themes of stress, violence, poor mental health, high rates of contraception use, which I think could be a pro and also a con, and I'll explain why. High rates of preterm birth, and also a lot of women having low income status. And so one problem with that is if we only focus on Black women that are low income, then we're not getting the full story. Is income as protective for Black women as others? Is education as protective? Is marital status as protective? Going back to contraception, so it says here, you know, long-acting reversible contraception. Well, I know from other previous research that I've done is that a lot of Black women felt like providers were very strongly pushing contraception, but maybe not so much breastfeeding or postpartum mental health or other topics that they wanted to talk about. So there could be some additional story behind that high rate of contraceptive use. So when we look at some of the state reports, in Georgia, less likely to receive prenatal care in the first trimester. Well, why is that? Is it because I have a lot going on, I didn't even know I was pregnant? Or is it because, you know, a lot of providers have left rural Georgia? And it's just harder, harder to access it geographically speaking. In Michigan, more likely to experience abuse during pregnancy, more likely to discuss abuse with the healthcare worker, which is great that they're discussing it, but is there a high rate of discussion because there's a high rate of experience? Texas, less likely to be physically active, higher prevalence of pre-pregnancy diabetes. So one positive thing that I want to highlight is that in North Carolina was the only state to have a Black specific fact sheet, but the data was from 2011. So I think we can do better. I think we have plenty of room to improve. So the literature review just basically says there's limited publications that actually center Black maternal health, whether locally or nationally. And I list some here, some of the 3 publications that did, but the first 2 really are trying to see how do we even get more Black women to respond to PRAMS. I'll share at the end of this talk a recent publication from Florida that showed a lot of women, Black and brown women in Florida, they had never heard of PRAMS, they didn't know. So if this survey comes in the mail or someone calls you on the phone, you don't even know what the data is being used for. We have a lot of distrust in our community. So again, we can do better. Another promising thing, shout out to people who did dissertations and theses but never published them. I did see on ProQuest that there were a few young women from an HBCU in Baltimore called Morgan State that used PRAMS for their dissertation. So we have to also see what have people found that may be a little bit harder to find in our databases and search engines.
Apologies, Dr. Gross, I just want to let you know there's 5 minutes left.
Oh boy, okay. So PRAMS literature review, again, the reference group is usually white women, findings focus on deficits, not strengths, and lots of room for improvement. So what I want to share with you in closing is the analysis of back page comments. So the last page of PRAMS, when we asked mothers to free write Unfortunately, we didn't have as many free write responses in our Black population from the PRAMS data that I used from 2016 to 2018. But let's see what we found nonetheless. And this is just some of the coding scheme. So again, I want to make sure that I let you know that several women reported positive experience. So we always want to highlight that. But the main things were medical concerns, barriers in care, and support needs. So here's more on that. So medical concerns, stress, high blood pressure, twins, pain during birth, postpartum mental health, barriers in care, Medicaid issues, lack of continuity of care, discrimination and maltreatment, which we've been hearing a lot of from news, social media reports, and support needs. So I made it through pregnancy, I made it through delivery. What help do I need? Postpartum wellness education, how to take care of yourself, parenting support, breastfeeding support, and can we have better policies on maternity? A few quotes for you. So this one just talks about stress during pregnancy, a fever that started at work, having a history of a stillbirth. And here in Louisiana, we have had some policy gains on having support for those that have had stillbirth. Okay. But this person went into preterm labor. This participant had a hypertension diagnosis and eventually a C-section. This is a longer comment, but basically the story is feeling like she was being discriminated against because she had Medicaid. And because of the treatment, switching to a new provider, which then made all the difference in having an overall positive experience. But how many women even are up for that task when you have so much going on during pregnancy? Support needs, just saying more support groups, more information about breastfeeding before delivery. And this quote is talking about maternity. So just a few that I picked out from the data. And I want to give one of my students a shout out. She used PRAMS for her thesis to look at Black women's breastfeeding behavior before COVID. So we're trying to publish that. And discussion, PRAMS has a greater opportunity to translate data into action. And we know that different reports, agendas have talked about the importance of data. We use data to try to make better evidence-based decisions. So we need to have better collection of data, harmony of data, transparency. And I also think that needs to include qualitative, lived experience data, observational data, testimonial data, and that PRAMS can be a key player in this. So tons of variables are available, which can be very intimidating. Some of the limitations there, but I think instead of thinking of these as limitations, is how can these be opportunities for improvement, right? How can more states do follow up to PRAMS respondents? How do we get more women to complete the entire survey and give those qualitative responses? But I think that's the community-based engagement piece that perhaps we're lacking currently. And I say we, I'm a researcher, I'm not affiliated with the state. I don't collect or analyze this data for the state. This is my own research project, but just some things to think about in case anyone is affiliated with PRAMS at their state or city department. Future plans, quantitative analysis, and just disseminating these findings through community channels so that hopefully more and more people are willing to complete the surveys when they come across their mailbox or across their call logs. And my hope is that this will also help others to explore Black maternal health. We already have the data. I'm sure you have the data, but are you looking at the data to say, hey, you know, and it's not just for Black moms, it could be for any subset population that you're curious about. right? But I know that the current crisis is definitely highlighted, that we have major Black disparities to address. I would love to see a Black maternal health dashboard with hover over state and see success stories as well as areas for opportunity. So if any of you have ideas on that, please connect with me. And I want to acknowledge my funder and also my research team. So what are your thoughts? Hopefully I did okay on time. But I'd love to hear from people.
We're just going to highlight one question in the chat about, we are running a little bit late, but there is one question in the chat and then another comment. So if you could share who published the North Carolina info from 2011, the Black maternal health fact sheet.
That was from the North Carolina Department of Health. So we found it on some state health department website. Hi, Bria, you connect with me on LinkedIn, or I can put, here is my email. I am presenting later this month to the PRAMS state coordinator. So I'm very excited to do that later and to let them know about my back page comment analysis. So I'm happy to stay in the loop with anyone that would like to stay in the loop with me.
All right. I don't see any other questions that haven't been addressed as of right now. There was the comment about how about robust holistic support and payment for birthing people completing PRAMS. And I'm going to join everyone in echoing their thanks to you for this wonderful presentation. We so appreciate your time.
Thank you all, and enjoy the rest of the symposium.
Bye, everyone. Thank you.
Take care.